Sir, the glasses that you're wearing right now simulate what a person that has glaucoma might see the world, how they might see the world. What can you describe how you can see right now?
Well, it's very narrowed, and I don't have a lot of vision in the center. I've got to look with one eye or the other.
The essence of glaucoma, a lot of people think it's pressure. They associate high pressure because you get pressure tests for glaucoma. But the main problem isn't pressure. That's one risk factor for glaucoma. What glaucoma really is damage to the optic nerve. And the optic nerve is the nerve that connects the eye to the brain. It transmits all the images. So it's like the cable coming out of your camcorder into a television. And if that nerve gets damaged, you start to lose vision from the periphery and then eventually the center, and then it's eventually like no cable going to the television, no picture. And so it can cause a progressive vision loss and eventual blindness. And one of the risk factors is pressure, but there are many others, such as family history and various things having to do with specific eye anatomy issues.
Oh, it would make life a lot tougher, for any activity. It's just surprising how much, I guess how little the field of vision is.
Glaucoma is treated medically and surgically. We usually start with drops, and there are eye drops that help to lower the pressure in the eye because that's one of the modifiable risk factors. We can change the pressure, and then that should decrease the rate of progression. Some patients, though, even with a low pressure, will tend to progress, and some patients, the medicines aren't enough to lower the pressure. So then we have other options. We can do types of lasers to help to lower the pressure that helps the fluid not build up in the eye. Because you can think of the eye as a sink. It has a faucet that makes fluid, and it has drains in the front that drain fluid. If the drains aren't working well or the faucets are on overdrive, you get too much fluid and too much pressure. So we need to decrease that pressure, and we do that either with medication, eye drops, or with lasers, or there are different types of glaucoma surgeries. And it's an exciting time for glaucoma surgery. They're working on more minimally invasive procedures that should help patients have a lower eye pressure and less glaucoma progression, but have less damage or downtime from the surgeries.
How would it feel if you went all day wearing those?
All day would be a struggle, and I can't imagine doing this for a lifetime.
Everyone wants to prevent diseases when possible, and trying to prevent glaucoma, there's not a whole lot that you can do to prevent getting glaucoma. But the good news is if it's detected early, we can do a lot to save you from vision loss. And so the key is really frequent, if you're a healthy person as you age, getting in for those screening visits, getting in to see an eye care provider where you have the pressure checked, where somebody takes a careful look at the back of your eye, and they really look at the optic nerve to see if it looks like it has glaucoma damage or not. And if there is any damage, doing important tests like a visual field or pictures of the optic nerve or assessments of the nerve fiber layer, which is the important receptor layer in the back of the eye. And so if you can find out if there's any problems back there, you can treat early. And if you treat early, that can really slow down the rate of loss of vision so that you never have blindness from glaucoma.